From KPRC2, this is Houston Newsmakers with Cambrell Marshall.
Good morning. The topic today is not an uplifting one, abortion. It is at the center of what is expected to be a Supreme Court decision this summer that will overturn the Roe v. Wade decision of almost 50 years ago that reaffirmed the woman's right to an abortion. To be clear, it's a medical procedure. It ends life. It is not something to be celebrated on any level. The fight against it has not always been embraced by the religious right and others as a priority, but here we are. My goal today is to start by not getting into any kind of political back and forth, but to get some clarity about some of the medical implications about all of this. Joining me this morning is Dr. Rola El-Siraj. She's the director of the Center for Health and Biosciences at the Baker Institute for Public Policy at Rice University. Good morning, Dr. El-Siraj.
Good morning.
For those who don't know, what is the Health and Biosciences Center?
So the Baker Institute is a global think tank, and the Center for Health and Biosciences is focused on translation of a critical scientific research into public policy and strategies, community outreach, strategies and interventions that improve the lives of people.
And so that would include women, I'm sure,
Absolutely.
Obviously. And now that we're talking about abortion, and in terms of abortion and the health of women as a result of either having or not having, how has that evolved through the years? Before, abortion's been around for hundreds of years. It's not going away. The question is whether it's legal or not and all that. But the ability of women to get them when they need them has been a medical issue as well, has it not?
Absolutely, and I think what you're referring to is access to abortions and reproductive health care. Prior to Roe v. Wade in 1973, it was banned in Texas, so women could not get abortions legally. Of course, they resorted to other less safe mechanisms or means of obtaining abortions. Since that time, since Roe v. Wade, it has become legal, but as you know, Texas has passed one of the most stringent anti-abortion laws that actually restricts women now to having abortions before 6 weeks, which is a time, of course, when most women don't even know they're pregnant. And those who do know, it gives them very little time because as laws have become more and more restrictive, especially in the South and in the Midwest in this country, the ability to access abortion has become more and more difficult for women. Therefore, even those who know they are pregnant early on, it really limits their options because of the timing.
Well, those who are against abortion would say that's fine. I mean, that's what they want it to be. The question then becomes, are there circumstances where something like an abortion would be medically mandated, but it's difficult to get because of some of the legal ramifications?
Absolutely. I mean, currently the restrictions in Texas even apply to women, for example, who have whose fetus, for example, is tested and found to have a genetic anomaly. And also there are, we can talk a little bit later about maternal mortality rate, which is Texas is one of the states with the highest maternal mortality rates, where having the pregnancy is actually puts the woman at significant risk. And in fact, abortion is a very safe procedure medically. Women are at 14 times a higher risk of dying from actually carrying pregnancies to term.
In some cases where we're talking about maternal health.
Absolutely, absolutely.
What kind of research is being done in that regard? You say let's not talk about it later, let's talk about it now. It's one of those real issues that you're dealing with.
Well, from a public health standpoint, this is really where, and the standpoint of Texas legislation and policy, one of the critical issues in our state, we have one of the highest maternal mortality rates in this country, and the United States has the highest maternal mortality rate of all industrialized nations. And a recent task force in Texas dedicated to this issue found that 90% of those deaths are preventable. In addition to that, we also have, of course, as we know, we have a lot of social and economic challenges in the state related to reproductive health and access to care. For example, Texas has the highest rate of uninsured residents. 1 in 4 women of reproductive age in the state do not have health insurance. We're at the bottom of the list when it comes to things like obtaining prenatal care in the first trimester, which of course is a significant determinant of outcomes in pregnancy. We also are at the bottom of the list when it comes to affordability and as well as access to health care.
So as a medical doctor, would you suggest that get the politics out of the way and prioritize on that part of reproductive health as opposed to?
That's exactly what I'm saying. And you know, a lot of focus is on what is best for women and what, and there are arguments on both sides. But really, if we want to prioritize reproductive freedom and rights, we should be focusing on or investing on significant issues in this state, such as healthcare access, as well as reproductive access to oral contraceptives, to contraception in general, making them accessible, making them affordable. Those are things that if you want to prevent abortions, okay, and that I would say would be a symptom of an underlying disease, and the disease is all these our healthcare system in Texas. If women, especially women of lower socioeconomic status, because we have a 16% of our state residents live under the poverty level, the majority of women who are getting abortions are actually women of color and women who are of lower socioeconomic status. Mm-hmm. We should be focusing on those populations. In addition to that, Texas, it falls at the bottom of the list in terms of federal funding for family planning services. Okay. And so if women cannot access, you know, what they need to make reproductive decisions, then we have a significant problem here that needs to be addressed.
We're going to talk more. We're going to do a Newsmakers Extra because there's more to talk about. We don't have enough time here on this segment, but we'll talk about that coming up. Okay, thank you.